How your body changes. After first-time sex, a comprehensive guide. Did you know your body goes through surprising changes after first-time sex? From temporary discomfort to a burst of feel-good hormones, we're breaking down exactly what happens and how to navigate it with confidence. Stick around for the Health Action Channel's comprehensive guide to understanding your body's response to this major milestone. Experiencing sexual intercourse for the first time is a significant milestone in many relationships, often accompanied by a mix of excitement, curiosity, and apprehension. Beyond the emotional and relational aspects, first-time sex can bring about various physical changes in the body. These changes are natural, vary widely from person to person, and can range from temporary discomfort to positive hormonal shifts. Below, we explore the physical and hormonal transformations that may occur after first-time sex, particularly in women, with additional insights into why these changes happen and how to manage them. Welcome to the Health Action Channel, your trusted source for clear, science-backed insights into your body, relationships, and well-being. In our video, How Your Body Changes After First-Time Sex, we dive into the physical and hormonal shifts that can occur during this significant milestone, from understanding temporary discomforts like pain or spotting to embracing the feel-good hormones that spark joy and connection. We're here to empower you with knowledge to navigate this experience with confidence. Our goal is to provide practical tips and debunk myths to help you feel informed and in control of your health. Want to learn more about your body and how to prioritize your health during life's big moments? Subscribe to the Health Action Channel for daily videos packed with expert advice, actionable tips, and answers to your most pressing questions. Hit the bell icon to stay updated and drop your thoughts or questions in the comments below. We love hearing from you for more resources on sexual health and wellness. Let's begin. First-time sex can trigger a variety of physical sensations and changes in the body. While some of these may feel uncomfortable, most are normal and temporary. Here's a detailed look at the most common changes, their causes, and what you can expect. 1. Pain or discomfort. During or after sex. Pain during or after first-time sex is a common experience for many women. According to the American College of Obstetricians and Gynecologists, ACOG, approximately 75% of women experience painful sex at some point in their lives, with first-time intercourse being a frequent trigger. The pain can stem from several causes. The hymen, a thin membrane partially covering the vaginal opening, may stretch or tear during penetrative sex. This is often considered a physical sign of losing virginity, though the hymen can also stretch or break due to non-sexual activities like sports, tampon use, or medical exams. Insufficient lubrication can cause friction and discomfort. This may occur due to nervousness, inadequate foreplay, or hormonal factors. This condition involves involuntary tightening of the pelvic floor muscles, making penetration difficult or painful. It can be linked to anxiety, past trauma, or cultural factors, such as a strict upbringing that associates sex with shame. If an orgasm occurs, the release of oxytocin can cause temporary uterine contractions, leading to mild cramping or discomfort in the lower abdomen. Use water-based lubricants to reduce friction, engage in extended foreplay to enhance natural lubrication, and communicate openly with your partner about comfort levels. If pain persists beyond a few days or is severe, consult a healthcare provider to rule out underlying conditions like vaginismus or infections. 2. Spotting or light bleeding. Light bleeding or spotting after first-time sex is relatively common, affecting 0.7% to 9% of women, according to the Canadian Medical Association Journal. This can occur due to the hymen may tear during penetrative sex, leading to minor bleeding. However, not all women experience this, as the hymen varies in thickness and elasticity, and some may not have a hymen at all. The cervix, located at the top of the vaginal canal, can become inflamed or irritated during sex, especially if penetration is deep or vigorous. This may cause bright red blood. Rough or unlubricated sex can cause small tears in the vaginal tissue, resulting in light spotting. Bleeding is typically light and subsides within a day or two. If the blood is dark, it may be residual menstrual blood rather than a result of sex. Persistent or heavy bleeding warrants a visit to a healthcare provider. What to do? Rest and avoid further irritation. If spotting continues for more than a few days or is accompanied by pain, seek medical advice to rule out infection or injury. 3. Burning sensation. A burning sensation, particularly when urinating after sex, is another common side effect. The proximity of the urethra to the vaginal opening means that minor stretching or irritation of the vaginal tissue can affect the urethra, causing a temporary burning feeling. A COG notes that about 75% of women experience this at some point. What to do? Urinate immediately after sex to flush out bacteria and reduce the risk of infection. Stay hydrated and avoid harsh soaps or douches, which can exacerbate irritation. If the burning persists for more than a day or two, it could indicate a urinary tract infection, UTI, or other issue, so consult a doctor. 4. Itching or irritation. Post-sex itching in the vaginal area can occur due to some individuals may be allergic or sensitive to latex condoms, spermicides, or certain lubricants, leading to itching or irritation. Sexual activity can sometimes disrupt the vaginal microbiome, potentially leading to itching or mild irritation. Use hypoallergenic, non-latex condoms or fragrance-free lubricants if you suspect a sensitivity. Avoid scratching, as it can worsen irritation or introduce bacteria. If itching persists or is accompanied by unusual discharge, consult a healthcare provider to check for yeast infections or bacterial vaginosis. 5. Risk of urinary tract infection, UTI. Sexual activity, especially for the first time, can increase the risk of a UTI. During sex, bacteria from the bowel or vaginal area can be pushed toward the urethra, leading to infection. Symptoms include a burning sensation during urination, frequent urges to urinate, and cloudy or strong-smelling urine. Urinate before and after sex to minimize bacterial transfer. Drink plenty of water and consider cranberry supplements, which may help prevent UTIs. If symptoms like burning, itching, or pain persist for more than a day, seek medical attention, as untreated UTIs can lead to complications. 6. Changes in nipple and clitoris size. Sexual arousal during first-time sex can cause temporary physical changes in erogenous zones. Increased blood flow and nerve stimulation can cause the nipples and areola to swell and become erect. This is a normal response to arousal and typically subsides shortly after sexual activity. The clitoris, rich in nerve endings, swells due to increased blood flow during arousal. This swelling is temporary and usually resolves within minutes after sexual activity. These changes are normal and indicate healthy sexual response. They are temporary and should not cause concern unless accompanied by pain or prolonged swelling. 7. Surge of happy hormones. First-time sex can trigger a release of feel-good hormones, including oxytocin, dopamine, and endorphins, which contribute to feelings of happiness, bonding, and relaxation. A study published by the Society for Personality and Social Psychology found that engaging in sexual activity once a week is associated with increased life satisfaction and emotional well-being. These hormonal changes can also cause physical sensations like goosebumps, flushed skin, and heightened sensitivity in areas like the nipples and clitoris. What to expect? The hormonal surge can enhance mood and create a sense of closeness with your partner. However, emotional responses vary, and some individuals may feel vulnerable or anxious after first-time sex due to the intensity of these hormonal shifts. 8. Changes in vaginal elasticity and appearance. The vagina is highly elastic and designed to adapt to sexual activity. After first-time sex, the vaginal walls and labia may stretch and relax in response to arousal and penetration. Over time, the vagina learns to adjust its elasticity to accommodate sexual activity more comfortably. Increased blood flow during arousal can cause the vaginal walls and labia to appear darker or more engorged temporarily. The clitoris may also become more sensitive and pronounced during arousal. What to expect? These changes are normal and indicate the body's natural response to sexual stimulation. The vagina will return to its usual state after arousal subsides. 9. Emotional and psychological changes. While not a physical change, first-time sex can also influence your emotional and psychological state. The release of oxytocin, often called the bonding hormone, can foster feelings of attachment to your partner. However, some individuals may experience anxiety, guilt, or emotional vulnerability, especially if the experience was unexpected or tied to cultural or personal beliefs about sex. What to do? Take time to process your emotions and communicate openly with your partner. If feelings of anxiety or discomfort persist, consider speaking with a counselor or trusted confidant. Common myths and misconceptions. Myth: all women bleed when they lose their virginity. Not all women bleed during first-time sex, as the hymen varies in thickness and may already be stretched or absent due to other activities. Myth: pain is inevitable. While some women experience pain, others do not. Pain can often be minimized with proper lubrication, foreplay, and communication. Myth: a broken hymen equals loss of virginity. Virginity is a cultural or personal concept, not a medical one. A broken hymen can occur for reasons unrelated to sex and does not definitively indicate loss of virginity. Discuss boundaries, comfort levels, and expectations beforehand. Condoms not only prevent pregnancy and STIs, but can also reduce the risk of irritation or infection. Engage in foreplay to increase natural lubrication and reduce discomfort. Urinate after sex and maintain good hygiene to prevent infections. Persistent pain, heavy bleeding, or signs of infection should prompt a visit to a healthcare provider. First-time sex is a unique experience that can bring about a range of physical and emotional changes. From temporary discomfort like pain, spotting, or a burning sensation to positive effects like a surge of happy hormones. These changes are a normal part of the body's response to sexual activity, while some effects like vaginal elasticity or hormonal shifts are universal, others like pain or bleeding vary widely. By understanding these changes and taking steps to ensure comfort and safety, you can navigate this milestone with confidence. If any symptoms persist or cause concern, consulting a healthcare professional is always a wise choice.